coming to do that. I really appreciate that. Dr. Bonnie Green, I had the pleasure of having dinner with last night, and I will say, I'm sure many things we talked about I won't say, but I will say that she has a very loving relationship with her husband, and I enjoyed seeing that. So, Dr. Bonnie Green is a professor and vice chair for research in the Department of Psychiatry and associate dean for faculty development at Georgetown University Medical School in Washington. She has studied the consequences of traumatic events such as disasters and war and the psychological and physical health consequences of individual traumas, including breast cancer, traumatic bereavement, and interpersonal violence. Her current research focuses on mental health needs of poor women with serious trauma histories who receive their health care in settings serving low-income patients, with a focus on patient-provider relationships and communication and physical health outcomes associated with trauma exposure. She is the principal investigator and director of Georgetown Center for Trauma and the Community, whose purpose is to develop innovative and sustainable interventions for trauma-related mental health needs of low-income populations. And she is also the PI of an IPRISP. So I looked that up, and that is the Principal Investigator of Interventions and Practice Research Infrastructure Program. And I still didn't quite understand what that meant, but I'm sure if it's important, she'll explain it. With a community partner to develop community infrastructure for mental health research. Basically, what I got out of this was that she's a very smart person and an expert in trauma. She was a young assistant professor when she won this is what I found out last night, an NIH grant to study what we now know as post-traumatic stress syndrome in the survivors of Buffalo Creek. I imagine that is part of what she will be talking about today. Thank you, Dr. Green, for all that you must have done for our community in the southern part of the state. Please help me give a warm welcome to Dr. Bonnie Green.
Thank you. It's wonderful to be here today. I'm very excited about the symposium, and I appreciate your indulgence to switch gears a little bit and talk about some research that we've done over a 15-year period. It's a 15-minute presentation, so it's going to be a broad overview, but just to give you a sense of some of the work that was going on in parallel in the mental health community. And I'm a researcher, so I have my bank of slides to show you as we go through this. As everyone has described, the clinicians from the Department of Psychiatry at the University of Cincinnati were the people who examined the plaintiffs for psychological impairment. And Jim Titchener, Fred Kapp, Janet Newman, the people from the University of Cincinnati who were involved in the lawsuit did all the original examinations. And we, Golding Glazer and myself and Carolyn Widget and a group of others came in after the fact and were able to obtain the psychiatric evaluations from our side, the University of Cincinnati, the plaintiff side of the lawsuit, but also the examinations from the defense side of the lawsuit. So we had the 600 evaluations, two evaluations on each person. So we had about 1,200 of these psychiatric examinations, and that provided the basis for our original work. And the original work that I'll describe was based on those psychiatric examinations that were already becoming part of the lawsuit. And then I went back later, and that was funded by a grant from the NIH, and then I went back later twice with other grants from the National Institutes of Health, where we did a 14-year follow-up of the adults and a 17-year follow-up of the children. So that's what I'm going to take a brief walk through today. As we said, there were about 600 people. We had 3 goals for our original study. One was to kind of put in to numbers in a systematic way more than the stories, which, the stories are certainly more compelling, but to try to systematize somewhat the experiences that people had in terms of the extent of loss that they suffered, the extent of life threat that they suffered, and displacement, and so forth. And then also what kinds of psychological problems they had. And these were described in both sets of reports. Both sets of reports actually went through the experiences that people had on February 26, 1972, but also in the weeks and months that followed. And then they also went through a lot of psychological symptoms. So I'm going to tell you what the reports showed from both perspectives. Post-traumatic stress disorder was not a diagnosis at the time, which Gerald Stern mentioned earlier. It became a diagnosis in 1980 as part of the Diagnostic and Statistical Manual, the DSM-3. The diagnosis was driven strongly by the work of Robert Lifton, which he mentioned this morning, by clinical descriptions from the Buffalo Creek disaster, and by Vietnam combat veterans who also felt that their time had come for their problems to be recognized. And that diagnosis actually pulled together a whole field of those of us who've been doing trauma research since then, because before that, there were the disaster researchers and the child abuse researchers and the war, people who are studying war, people who are studying rape trauma, syndrome. And those people all came together, and we created a field following the post-traumatic stress disorder diagnosis. So it's really propelled a lot of the work that we've done in the years between this disaster and work, and then 1980, starting in 1980. So, as I said, I'm having a little trouble here because I need to look at something to see what's up on the screen. So we had two sets of interviews, as I mentioned, one from the prosecution and one from the defense, and they documented similar symptom profiles. So not the same extent of impairment, but very similar types of impairment. We also looked at a small sample of people who lived in Buffalo Creek but who were not involved in the lawsuit. They looked similar to the people who were involved in the lawsuit. So it certainly wasn't a matter just of the litigation. The reports from the University of Cincinnati, the plaintiff's side showed, in our systematic rating, showed moderate to severe impairment for about 2/3 of the survivors that we studied. And the defense reports, as I said, also showed similar profiles, but not the degree of severity. So about 1/3 of the people we would rate from those reports showed moderate to severe impairment, but in any case, that's a lot. Amongst the kids, not quite so much. We looked at between 2 and 15 at the time, but about 1/3 of the children were rated as having moderate to severe impairment. And we went back later, once PTSD was a diagnosis, and we used both sets of reports to make a post-traumatic stress disorder diagnosis among the children. And we estimated at that time, and you'll see when we do the follow-up, we get actually a fairly similar number when we actually did an interview that included PTSD, that close to 40% of them would have met criteria for post-traumatic stress disorder in 1974. We did find that in spite of the severe exposure of the entire sample and the relatively severe impairment among the sample, that people's individual experiences still made a difference in predicting who would be doing better and who would be doing worse. So the extent of bereavement and life threat and displacement were all predictive of how people would be doing in 1974. We went back 14 years later. I'm not sure exactly, I don't remember exactly why we thought we would do that, but most of the disaster studies at that time took place very shortly after the event. So people would go in shortly, they'd be there 3 months, 6 months, and we started thinking, well, what about these people that we interviewed in 1974? You know, how are they doing? And the NIH thought that was an interesting question, I guess. So they supported our going back. We were not able to find everyone. We were aware of at least 50 people who had already died among the adult sample of 381. And we were able to follow about 40% of the people who were in the original lawsuit. And we also were able to find a larger sample of people who lived in the Buffalo Creek Valley who were not part of the lawsuit. And then we also looked at some other coal mining communities in West Virginia who were doing much better in '86 than they were in 1974, which makes sense. A 14-year period had gone by. And so the blue are the guys and the pink are the women. And the darker scores are how they were doing in 1974. So you can see that, like if you look at the overall severity, that the current severity of impairment of how people were doing was about half of what it was in 1974. Nevertheless, people were still suffering, and we did, as I said, we were able to do psychiatric evaluations and determine post-traumatic stress disorder for men and women, both in 1974 and in 1986. And you can see that the rates, I think one of the take-home points of this, the rates of PTSD were huge in 1974 among this group. And, you know, we heard a lot of descriptions this morning and people talking about those descriptions, but if you actually would turn those into a diagnosis, more than 30% of the men who were involved in this lawsuit and more than 50% of the women would have met criteria for post-traumatic stress disorder at the time. And those numbers decreased in 1986 significantly for the women, not significantly for the men. But even so, rates of 20 to 30% of PTSD are huge compared to the general population, which is about 8%. We did not find differences to speak of between people who had been in the lawsuit and people who hadn't been in the lawsuit. So that did not seem to be determining how people were doing. We did compare with another community who had been unexposed, and the folks at Buffalo Creek were much higher currently in 1986 on their anxiety ratings, their depression ratings, those diagnoses, and also on post-traumatic stress disorder. So I said they continued to have 23% of them continued to meet criteria for PTSD. We went back in 1989 to do a follow-up of the children. The children were now between 19 and 32 years old. And we were able to find about half of the original children. There were about 2/3 of those were still in the Buffalo Creek Valley, and about 1/3 of them had moved away. And if they were anywhere near the valley, they would have been in the 66, we would have followed them up. But some of them had moved to, Oregon or Michigan or Ohio or whatever, and we weren't able to follow them up in person, but we were able to track down quite a few of them by telephone. And then we did find another, I would say in this case, kind of a convenient sample of folks from another coal mining community in Kentucky, just as kind of a as a general comparison group, certainly not necessarily a perfect comparison group. And we did all of the same measures as we did for the adults. So, as I said, the children at that time were between 19 and 32. About 2/3 were women, about 1/4 were African American. And they had really serious experiences. 80% of them had lost their homes in the disaster, and half of them had been separated from one or both of their parents, even though it was a Saturday morning. Few had lost household family members, as people know, or may not know. Some of you may not know that because it was a Saturday morning, a lot of times families were together, so whole families often died together. So not too many people in this sample lost their household members, but there was a lot of severe exposure as part of this. They declined over time on the general ratings of anxiety and depression that we did. We didn't actually document any substance abuse in the original study, so we did find some of that, which it's a young adult sample, we weren't surprised. But we found a lifetime PTSD prevalence rate of 34%, which, if you remember, when we went back to those original reports and did it, we got 37%. So that's pretty close. So we're talking about, a third to two-fifths of these children who would have met criteria for post-traumatic stress disorder. But at the time we did the interview, it was down to 7%. So in 1989, it was down to 7%. Lifetime, which is about general population averages. Current depression is about general population averages, although lifetime much higher. So when we looked at a comparison with a local community that was not, I did want to say that we also were really, at that point, most of the children had gotten involved in some lawsuit or another, so we were not really successful and ended up not looking for a comparison sample within Buffalo Creek who had not been involved in litigation, but we did look for an unexposed sample. And for those, we used the Buffalo Creek residents who had not moved away to make the comparison, and we did not find any differences between the people who had been in the disaster and the current rates in the general population and also the rates in the unexposed community. So the children who were involved in that event did not show current effects of the disaster compared to their earlier status or to general population norms. So just to sum up, we did find significant diagnoses and symptoms in 1974. They were related specifically to the person's individual experiences in that disaster. The PTSD rates were very, very high in 1974, whether we looked at it retrospectively or we were rating symptoms at the time of the two sets of interviews. And the adult sample improved significantly over time in all areas, but they still showed residual effects from the disaster even in 1986. The children did not show residual effects, and I have some thoughts about why that might be, and maybe you have some thoughts about why that we might have found that. I did feel like well, first of all, most of the children were with their parents, and some studies have shown, like even starting with the bombings in London during World War II, that the kids who stayed with their parents did better than the kids who didn't stay with their parents. So most of these children were with their parents through the whole thing. They also, most of the children, the lawsuit had been settled, most of the children had gotten involved in lawsuits. They had the opportunity for some of the activism that Beth was talking about earlier. So, I don't know, and people may have some other ideas about why we found what we did with children. So those are my colleagues at the University of Cincinnati who were involved in the research. And the people in Buffalo Creek were wonderful to us when we were there. They opened, my graduate students a lot of them were swimmers, and they opened up the community pool for us an hour early so everybody could swim their laps, and everybody was just really wonderful and very welcoming, and it was really wonderful doing this work. Thank you.
Is there one quick question? Because otherwise we are slightly late for lunch, but I don't want anyone to feel cheated out of any kind of comment they might want
You're talking about like treatment. Where the question had to do with whether there was psychiatric follow-up or treatment. And our understanding from the people that we talked to, in general in the community, but also to the individual people, that almost no one received psychiatric services or psychological counseling or whatever. And you heard that there was some attempt to try to set up those services. And obviously now, you know, that would be one of the first things people were trying to do. But I think the time frame, it's still stigmatizing to get psychological services, even, you know, urban communities. It's one of the things that we fight with all the time when we try to do interventions with people who have very treatable psychological and psychiatric problems. These disorders are very treatable, but at the time, I think it wasn't part of how we handled things. Want to come up here?
We're going to convene for lunch now. You will not have me in the afternoon, unfortunately. John Taylor will take my place. I'm sure he'll do a somewhat adequate job of that. But we will reconvene in the new event space. This is the inaugural event for our new event space at 1:30. So thank you very, very much.